The ayes have it. The ayes have it. Honourable members, the question now is that vote health stand part of the schedules.
Mr. Chair. Mr. Chair.
I call the honourable member Dr. Paul Hutchison.
Thanks very much, Mr. Chair. It's an absolute pleasure to speak on the estimates of vote health because the national government has been growing and protecting our public health service during very tough times. In fact, these latest estimates are a benchmark in showing that we're investing $14.1 billion in health. This is $2 billion more than was invested back in 2008, and we're making every endeavour to ensure that every health dollar is well spent with better services and less bureaucracy. So, Mr. Speaker, Mr. Chair, undoubtedly it is quite extraordinary that this government has been prepared to continue during these tough times to invest in this very vital area of health, in education and, of course, in science and innovation, all areas where the increased investment has occurred. And I think it was particularly significant a few weeks ago when, under the excellent leadership of the Honourable Tony Ryle, it was pointed out that New Zealand has the third highest growth in health spending of 28 OECD nations for 2009-10. This is quite remarkable, is that the average growth of the OECD in health investment was zero, and that during these tough times there have been quite a few countries that have actually reduced spending, such as Denmark and Norway and the UK, where there have been considerable funding cuts. So we've seen New Zealand continue to invest in health, with spending increasing by 3.4% per year in real terms, which is a very remarkable record, and we now have the fifth highest level of public health spending as a percentage of GDP in the OECD. This may or may not be a great thing, but I believe that in New Zealand's case, where we are concentrating on increasing productivity and increasing frontline services, we are indeed making great headway. Because I think we've seen across the spectrum in the world, we've seen countries like Singapore, which has a remarkable spend, a total of about 4% of GDP on health, compared with Australia, which is a bit above us. I think we're public and private about 10%, public probably about 8%, Australia's a wee bit above that, UK a bit less.
Much younger population.
But, yeah, much like younger population, as you say. But the United States there at about 18% of GDP. Singaporeans living longer and infant mortality less than half of ours. So what we've got to do is exactly what the government has been doing, increasing on diminishing bureaucracy, bringing in the frontline services and ensuring that productivity is increased. And this is in stark contrast with what happened with the previous Labor government that doubled the health budget, yet in real terms fewer people got operations. An awful indictment on those last years. And, Mr. Chair, it is very, very encouraging when we look at what's happened to the health workforce over the last 4 years. Only today I got the updated numbers, and I understand we've delivered over 1,000 extra doctors in the last 4 years and 2,400 extra nurses in public hospitals. That's a pretty good record, because all we heard from the previous Labour government was Annette King strutting round talking about her workforce reports, and she had 42 of them. 42 of them in 9 years with very little. Mr. Chair?
I call the honourable member, Dr. Paul
with
Hutchison.
Very little increase in the workforce during that time. A huge amount of talk. It's very exciting that again this national-led government has brought in a program to combat rheumatic fever, a third world disease that indeed was identified by the previous Labour government. They talked and talked, but they did nothing. In these estimates, there's an increase of $12 million, which adds to the previous $12 million, and already those children in various parts of New Zealand are being swabbed and treated as appropriate. And of course, not only has the national government done this, but we've also insulated in the order of 140,000 homes. More than that, he said, more than that. 160? Something like that. Whatever, a significant amount, and a significant amount more than the previous Labour government ever did. But then we go on to elective surgery. And once again, the record of this national government is extraordinary. 27,000 extra patients a year are now getting elective surgery. And indeed, we've decided that there's going to be a new target. We're lifting our game by ensuring that all patients booked for elective surgery receive it within no more than 4 months by the end of 2014. That was something that the Labour government could never have dreamed of. What did they do? What was the term? Cull. They used to cull patients in their thousands. Not just in their thousands, in their tens of thousands. 30,000 at a time were culled by the previous Labour government from their waiting list. But, Mr. Chair, I must say I am very, very excited by the national government's record in immunisation, because it is spectacular, absolutely spectacular, that only 4 years ago the average 2-year-old, the immunisation was 73%. 4 years ago, it's now boosted to 92%. In 4 years' time, it's gone from 73% to 92%. This is one of the most effective methods of preventative health that we know of, and under national it has been delivered. And we've set a new and ambitious target for this as well, to have 95% of 8-month-old children fully immunised by the end of 2014. And I think it is worthwhile at this point acknowledging all those wonderful health professionals that are out there making this happen up and down the length and breadth of New Zealand. They have been absolutely wonderful. The passion that they have for their patients. And I must say, look, I happened to be in Middlemore Hospital the other day with a relative who was having a baby, and the service she had was superb. 10 years ago, there might have been 6 or 7 shifts during a 24-hour labour. One midwife came on for 12 hours during the day, and during the night, another midwife for 12 hours. It was very, very impressive. Then she went off to a little country hospital in Pukekohe, where they looked after her just superbly. There was no rushing home. She was allowed to go home when she wanted to, and when she was ready to go home, when the breast milk was in. It was all of this being done under a new philosophy and a new efficiency, where frontline services are being focused on by an excellent national government. And I want to just say that the zero fees for doctors' visits under sixes is also going extremely well under this government. Nationals boosted the portion of children under 6 receiving free doctors' visits during the daytime to 93%. And that's got to be pretty good. This is a massive improvement since 2008, when it was 70%. 70% at the end of Labour's tenure after 9 years, 93% under National. Mr. Chair, National has done a great job.
Yeah, Mr. Chair.
I call the honourable member Young.